Hey everyone, good to see you all. Happy to be here. It's another episode, it's another live stream of KLF Deep Dive. I'm here with Heather Brandell. Heather and I have known each other mostly through a LinkedIn connection, but turns out she and I had a connection from my past life where I worked with, was it your aunt?
My aunt. Yep. Yes.
Um, and it's kind of cool to see it come back around. Heather is a uh, consultant, works in the is it cosmetics and wellness
Cosmetics and personal care. Yep. In the personal
personal
care
care
space.
regulatory space. And I'm really excited to have her because we get to have some of these conversations that she's already facing on a day-to-day basis. But before I keep going, my name is Darshan Kulkarni. I'm principal attorney at the Kulkarni Law Firm. We focus only on life sciences, FDA regulatory and compliance issues. I love interviewing people like Heather who are incredible at what they do. It's a space that is growing right now. I'm working with clients in the space as we speak. So I'm really excited to talk to Heather more about what she does and some of the big questions she keeps getting. But before I continue, Heather, do you want to introduce yourself, add more to that?
Yep. I am Heather Brandell. I am the founder of Brand App Compliance. So I do regulatory compliance for cosmetics and personal care and really specialize in claim substantiation. So I look for, those clients that are ready to test their products and put them on the market and need to really support those claims. So it's Josh, I thank you for having me. This is great.
I get to play around with sound effects, so this is fun. Thank you, Heather. So Heather, let's start from the beginning. What are the types of clients you usually get pulled into?
Yeah, so my clients typically a lot of skincare clients, hair care. They're either well-known brands that are looking for some strategic claim substantiation support, or they're small startups that are really at the start of their company and they're ready to put their products on the market. And they need help from a regulatory perspective, full compliance, making sure their formulas are compliant, their packaging, and then also that their claims are substantiated for when they go to market.
And what when you say claims are compliant, what are you looking at when you look at compliance?
Yeah, so I'm looking to make sure, first of all, that they're a cosmetic claim and that they're not going over into the drug category. So that's been a really hot topic, I feel like, lately, because as technology has advanced so much in the cosmetic industry, those claims are getting farther and farther into that realm. And I'm sure you deal with this as well.
I'm seeing a lot of that myself, which is why I think it's interesting. You're talking about drug claims versus cosmetics claims, and a lot of my clients are trying to do this. Oh, we're not drugs, we're not cosmetics, we're cosmeceuticals, and we're therefore subject to a whole different set of laws. What do you say when clients say that to you?
I tell them that they need to stay within the cosmetic category and not make any structure function claims because they are truly a cosmetic product. So I think it's a fine line of communicating their science while reducing their risk. Or it could be a business decision where they might determine we want to take the risk and go kind of on that gray line that is there, and that's their business decision, but I can provide them with advice and the risk levels that are there.
Now, you used a term that gets often used in our industry, the idea of a structure function claim. What is that?
Yeah, so that's actually changing something within the body. So unlike a cosmetic that's, changing appearance, it's making you more beautiful, attractive. These are the definitions from the FDA. A structure function claim is actually changing something within your body. It is eliminating wrinkles. It is, you know, changing the skin barrier, protection, all these claims that either are changing a function or have an FDA monograph. These are just all things to look out for.
So now you might be. This is one of the ones I get all the time, and I struggle with it a little bit more than I should. But the distinction between it hydrates your skin versus addresses dryness. How do you sort of do that balance of hydration, dryness? One is actually a claim about the about the skin itself, while the other one is the effect of the product, not necessarily on the body. How do you draw that distinction, if you will?
So I think that they can be comparable in a way. I think it's the saying the same thing in two different ways. So I would still support the claim the same way, but if I
Okay.
have hydrate skin, then that is ideally good for dry skin, that product. So it's just different ways to say the same claim. So if a company is saying this product, this lotion addresses dry skin, and they have no support for that claim, then they think that it's okay to make it, but they still need that support for that
So
claim.
when you say support, that brings us to the section on evidence and how do you prove what you're saying? For those people, by the way, who aren't listening and they're like, I love what Heather's talking about, take a look at the QR code on top. You should be able to click on it, go to our website. So that's right at the top. But we were talking a little bit about support. So tell me a little bit about how you help these companies evaluate what is the amount of support they need, the amount of evidence they need.
Yeah, so typically they'll come to me with their list of claims, right? I have this product, I formulated it for these functions. Here are my claims that I desire to make about the product. And then I help them back into those claims with the support before the product is launched on the market. So it depends. It could be clinical testing, it could be consumer testing, it could be a combination of both. Um, it all depends on what claims they want to make, but we kind of walk through that process together and see if you want to make this product hydrate skin, by 90%, that's a clinical claim. My skin feels hydrated is a consumer claim. Maybe you want to say both, so you might need both consumer and clinical testing, but it's so important to start with the claims what you want to say rather than do a test and then try and figure out what claims you can make from the test, because that typically doesn't work. You're usually then wanting different claims that were not substantiated.
Which really gets us to a really interesting point that you're kind of making here. This idea that you need to plan the process. Don't go in there and just willy-nilly start throwing claims around, because that's going to be, you're making real-time decisions and that's going to come back to haunt us. So talk me through your process. When a client comes to you and says, I'm a brand new cosmetics company, I make lipstick, something simple like that. So in that case, walk me through how you're guiding this client to making the claims they want to make and where they're going to make those claims, and how you support them through that process, through the life cycle, if you will.
Yeah, so my first step is to review their quantitative formula. So really understand what their formula is made up of, what active ingredients, if any, do they have in that formulation, and are they in at an active level? It's really understanding, have they done any preliminary internal testing, whether that's instrumental testing in the lab or any type of very small internal consumer testing, clinical testing, and then take a look at their claims and determine, okay, we've seen, in lab testing, let's say an instrumental, in a drawdown with a gloss meter, we've seen that the gloss lasts X amount of days. Now we want to go into consumer testing or clinical testing to support that. So it kind of gives us an idea of where we can start rather than just throwing darts at a board. We know that the gloss on the lipstick will last, I guess it probably won't last days on the lips. That would be nail polish, but lipstick could last 4 hours. Just coming up with these things, but at least there's sort of testing and data behind it. So if they don't have that internal testing, then they likely have raw material support that we can at least start with and see what backs up those ingredients that they've used for their formula.
So let's start with that first part, right? So they come to you, you go, okay, we've signed our CDA, we've signed our MSA, we've signed our agreement between each other. Heather, what I'm going to do is I'm going to give you all of my manufacturing data. First of all, the first thing I push back on is don't send me everything, because I'm not going to read everything you sent to me. I don't need everything you've thought of. Let's start parsing what information you want. You pointed out, you start with the ingredients. How are you judging the efficacy of those ingredients? For example, a 4-hour gloss, as you pointed out. are you saying just give me the results of the testing you've done? Or are you saying give me the ingredients and I'll do my own research, and based on the research I've done that's outside in the market, this is what I think you can support? Like, how do you back into it?
A little bit of both. So depending on what they have available, a little bit of both. I'll take a look at what they have done. I've also, yes, can pull, data to support that ingredient, and then what has that manufacturer of that ingredient done. So say you put it at 1%, 1% is an active level. What data does that manufacturer of that raw material have to support that claim? And then what testing did they do to come about that claim? Sometimes the testing is not one-to-one, obviously. If they're doing a certain test, or maybe the raw material supplier is supporting it by lab data, and that can't be done for the finished product. It could be different, but it can give you a starting point. I also can do some small screening studies as well. So if the brand is like, let's test this out, I can test it on 5-10 people, do a small scale study to kind of see where are we at, what are we getting good results at. That's very small, obviously can't be used for claim support, not statistically significant, but just gives an idea. If the lipstick doesn't last, 2 hours on 5 people, then we know we need to go back to the drawing board. Maybe we need to reformulate. Maybe we need to test further or increase the number of people, but we have to understand what the product can do. What was it formulated to do? I like to look at the brief initially too, from the very start. So if I'm not involved in the product briefing process, then I like to go back to the product brief. Like, what did the product brief state? What was it looking for? Because if the product wasn't made for that purpose, it most likely will not be able to substantiate that claim. It has to be formulated in order to be efficacious.
So, see, I worry about terms like that. The idea of, you mentioned an active level, you mentioned efficacious. The moment you start saying efficacy, you start saying active level, I'm thinking drug. And how do you draw that balance? I know you're speaking to me who's not making a product claim, so it's more of a conversation between two professionals. But when you're talking to a client, how do you help them avoid making those same claims?
Yeah, so it depends on the client. So my personal care cosmetic, no OTC clients, we say active level in the terms that it is at the active level that the raw material manufacturer has indicated will provide a benefit. If it is an OTC product, we do not use that word at all, unless we're talking about the active ingredient within the OTC. All the other maybe, cosmetic ingredients that might be in there at those what we call efficacious levels according to the manufacturer, we never use those terms with OTC products. So it depends on who my customer is. And then it is, we have to be very careful, of course, and I'm sure you see it a lot too, of in the drug world, we can't use the active word within a claim.
The drug world is its own beast. And as you said, you draw the difference between OTC and prescription that has its own, again, many of the same distinctions you're drawing, which is clinical claims, and you're talking about safety claims, and you're talking a little bit about HEOR claims. They all get treated differently, if you will. And OTC they already have predetermined claims that you can use. So you can go in there with a Tylenol and start saying things like, we will address your cancer with it. Well, you have no proof of that. And if you want to go treat cancer with Tylenol, then you need to go first get the studies done, which don't exist for the most part. So, and watch someone point out the study that cures cancer with Tylenol to that. Let's hope that's not out there. But what I'm really also fascinated by is this idea that people are coming to you. They're now saying, I want to, I want Heather's help. I want her expertise to guide me on how best to think through this process. You're now coming up with the various types of claims. You're saying that these claims work. What are the biggest mistakes you're seeing in terms of the claims people want to make versus the claims they should make, and how do you help guide them through that process?
Yeah, I think the biggest mistake is jumping into the claims testing before you know what the claims are, but also not having an expert on your side to help you develop the claims testing as well. So, I can come in at different steps within the process. Sometimes people pull me in after claims testing has been completed and they'll say, "Here's my testing, here's the claims I want to make. Can you just confirm that I can make these claims?" And sometimes they don't have enough subjects. It's not the right study. It wasn't the right instrumentation. And here they've spent all this money to, try and support their claims, but it might not be what is industry standard. So bringing an expert in from the beginning, really at the product brief stage, is the ideal stage to come in and say, "Hey, I'm going to brief this. Here are the claims I want to make." Right there and then we can eliminate any drug claims and really make sure that those claims we're formulating the product for are cosmetic claims. And then I usually will carry out through the whole entire process. So from briefing to iterations of the formula, and then all the way through to marketing, once it goes on websites, social media, packaging, is it all compliant? So it's not just about like getting a claims list and you're done. It's a process that continues on and on as the product evolves. I don't know if I answered your question.
You did.
You're that.
Doing great. We're keeping it general anyway, so you're doing fine. You're doing great. Let's take that next step though. What you're really talking about is being there early on to guide these clients through the process. Let's be honest, clients don't bring you on that early, that as often as they probably should. So now you're stuck with dealing with what you have. How do you talk to these clients and go, "This would have been great. I could have helped you way earlier on. You've spent a boatload of money." How do you salvage, or sort of, what is that client discussion like to salvage the money they've spent, but still sort of stay on the lighter side of the gray zone, if you will?
Yeah. So all data is good data. There's never bad data, right? So there's always something we can learn from the data. And what can they substantiate? What are great aspects of their product that did come from the testing? Maybe it wasn't what they expected, but there are some things that might have surprised them. So maybe they need to pivot their marketing, but they do have some really great attributes that they can then market to their consumers. And if data does come back bad, then sometimes I'm brought in then to, okay, help us. Did we do the right test? Did we do the right subjects? Do we need to reformulate, and bringing me in for that process as well? But all data is good because it's always a lesson learned and there's always something good to come out of it.
So now you've got a situation where you've got your claims list and you've vetted them. You hopefully have support behind a lot of them.
Mm-hmm.
Where are most people using this in your experience? Are they reaching out to get it onto the shelves, or is it usually now, is the trend as you see it more direct to consumer, in which case it changes the mix, the marketing mix, if you will? What are you seeing as the current trend for your potential customers?
A mix of both. Some are going into big retailers. So those are I would say, the harder ones to get into, which really need that claim substantiation because they may require that you provide it in order to be in that retailer.
Yeah.
And then there's smaller D2C brands that aren't on shelves. So maybe it's not as important that they have claims on their packaging because their website is really going to be selling the product. So my advice to them is typically, take your risks on website if you're going to take any risks, but really keep your packaging very compliant because you don't want your packaging pulled. So
I love that. But now let's talk a little bit about those big box retailers.
Mm-hmm.
I assume you've walked many clients through that process. Talk me through the engagement at that point. How does it shift? How does Heather come in? How do you save the day, if you will? So talk me through what are the big points of discussion, and how are you sort of addressing those proactively or reactively?
Yeah. No, I mean, so proactively, typically, I create a claims dossier for my clients. So that's typically what will need to be submitted to the retailers. Um, as a robust claims dossier as we can create to support that product. And that will often help. Reactively, we go into the testing. What testing do you have? What formulation support do you have? And combine everything. And again, try and put together what they have. And there's no, it sort of is what it is. This is the data we have to support it, and submit that. And ideally, it's enough. But if it's not, then we have to come back together and go back to the drawing board. What do we need to do to get enough substantiation to be in those retailers?
Now, talk to me a little bit about the expertise you're seeing internally. What are the qualifications of people who are questioning your data? Are they experts? Are they often effectively interns who just got sort of promoted? Like, what is your experience dealing with them?
It depends on the retailer, and they have all different systems. Every retailer has a different system that you will enter all the information in. So it's a lot of, I kind of say sometimes it's harder than the FDA registration, because every retailer will have a different platform. You need to learn that platform and enter all the info in. They require a lot of information, and rightfully so. They're the ones selling your product. They want to make sure that products they're selling are safe, they're compliant. They can be sold in the US or EU, Canada, wherever they may be located. So I understand why they are so diligent. Again, the brand, it goes back to the brand. Even though the retailer is requesting all this info, the brand is ultimately responsible, which I do remind my customers often as well, because sometimes coming from, a raw material supplier, I want to use this data for my product. You have to remember you're the brand and you're the one that's responsible. So you have to be able to support what you're saying.
So big box retailers lock down the process because they may feel a certain amount of, they're often their clients, so they want to make sure that the claims being made are appropriately supported. There's the appropriate backup to all of it. And then you compared that to websites. And you were like, if you're going to be a little on the darker side of the gray zone, you might be able to do that more on your website. So talk to me a little bit about how you help with website reviews, and what are you looking for, and what are the big causes and problems there?
Yeah, I would say the biggest cause and problems on website review is disclaimers and disclosures. So just making sure that they are present if they are needed, and that they're not hidden, right? That's the biggest thing with disclosures, is they have to be visible, and even on a cell phone. So not only viewing it on a computer or a laptop, but also viewing the website from a cell phone to ensure those disclaimers are seen. And I do full website review, because a lot of the times people don't realize claims are often hidden in FAQ pages, in About Me pages, not just product detail pages that claims are hidden, but it's throughout the entire website. So it's important to do like a deep dive.
So do you find yourself looking at terms and conditions and privacy notices and stuff as well, or you leave that for the lawyers?
I leave that for the lawyers. I do advertising compliance. So any kind of social media, disclosures, and with influencers, just making sure that there are terms and conditions on the page. Yes, I will flag that, but I am not going into those.
Right. Which you raised the next two pieces I was going to get into, which was social media and influencers. Let's start with social media for a second. So what are you seeing as the hottest spaces right now in social media where claims are being made? Because I know what I would say, but I'm curious what you're seeing at a day-to-day basis on a professional level.
At a professional level, TikTok for sure. Seeing a lot of claims on TikTok, made about products. Instagram still, and a lot of influencers that are making claims, and whether they are paid influencers or receiving free product, that may not be known, right? So that's, I think, something that's important. That's something I advise brands on, is that if you're even giving out free product, you need to tell your recipients to disclose, I received this product for free, some sort of disclosure hashtag. So sometimes it's very hard to tell who is being paid and who is not being paid. And that's the whole thing with the FTC and why they are finding this so important, because it's hard to determine what's an ad and what is not.
In fact, NAD has come out and said that they just launched an influencer program that they were talking about. They actually came on this podcast and they talked a little bit about influencers, and how getting these influencers vetted is a good idea, and these influencers can go now get pre-vetted, and that might become the industry standard as we continue, which is if you're going to use an influencer, they need to go through the program. They need to understand what liability they take if they don't do the appropriate disclosures like they probably should. So you talked a little bit about TikTok, Insta, influencers. What are the big cautions that you'd put out for each one of those?
Big caution would be, if they are a paid influencer or receiving free product, that they are making claims that you can support. So they can't just say, I'm wrinkle free now after one use of this product, if you can't support that claim. So they are your walking advertisement. And I think that's important for brands to understand. What have you seen out there in the, what I call the wild, wild west of marketing?
For me, around influencers, I think one of the realizations around my clients tends to be that they seem to think that because the influencer doesn't work for me, I can't control them. And therefore they can say whatever they want. I didn't tell them to say that. I just happen to have given them money, and that seems to generate a good sort of result. Well, who am I to stop that conversation? And I go, that is a terrible idea, because you'll end up paying them. They're your agents. You can't allow them to say these things. Then the question is, do you have a duty to correct if they come out and say these things? I would say it depends on your contract. Make sure that you have, depending on who you're working with and the influencers, make sure you have the right to either correct them or they take down the post or something like that, because you don't want to be in a situation where the influencer says, I'm not taking it down. One of my favorite ones was actually in the drug world, where Kim Kardashian came out and talked about a drug, and the FDA called her out on it. And the result was put out another ad with Kim Kardashian. Like, this seems like this was actually better for you to get the warning letter, the 483 from the FDA. It worked out for you. But because I think the second engagement got even more likes as a corrective statement. But in the cosmetics world, I think that, and you need to understand sort of where the jurisdiction of the FDA versus the FTC ends. And these people are often kids. They don't know any better. That's why you hired them. You can't have it both ways, where you go, these are kids, I'm going to hire them because they're kids and they can connect with my audience the way I'd like them to. At the same time, go, you're an adult, you signed a contract, I'm going to hold you to all these terms of the contract, because they just don't know any better. Now, there are going to be kids who are very, very smart, and they're going to have teams that help them control that narrative, if you will. But know who you're connecting with, and know that if things do go wrong, you still deal with the fallout, and they will deal with it as well. And you don't want to be in a situation where both of you look bad. So I think that's one of the big areas I see. I think the other area around TikTok and Instagram, I think the claims being made more often than not that I get pulled into, to be fair, are so outlandish that you're like, come on, no one actually believes that. But now you've put it out there, we've got to address it. Simple thing, you need to have a CAPA plan, which means that you need to not just pull the ad, but then how do you prevent something like that happening again? And what processes do you have internally to catch that? And maybe that is using a Darshan, that is using a Heather to help with that process. But I think those are some of the things that pop up in mind. Anything more you want to add to that?
I just think it's also important to audit. So you're responsible to audit, like you're saying, like, how do you prevent it? But you should always be auditing your influencers to make sure they are following those guidelines and that they're not making crazy claims that you can't support.
I love it. Now, Heather, we're about at the endpoint level. How can people reach you outside clicking on the QR code on the left-hand side?
So you can also reach me on LinkedIn.
And you go to Heather Brandel, and you should be able to reach her.
Yes.
And Heather, thank you so much for coming on, and this was exciting.
Yes. Thank you so much. I always love chatting about claims.
Hello there.